Many times women come to me saying, "Oh, my periods are irregular. I need help." But when I take a bit of history, I find that they have very perfect cycles. And I've met quite a bit who had no idea their cycles were irregular at all, right? Because they saw their period every month. So my name is Stephanie Nyong, your cycle coach. In this video, I'll be telling you the tests to do if you suspect that your cycles or your periods may be irregular. And to clear the air first, I'll be starting off by giving instances where a woman is said to have irregular cycles. So you don't go booking tests you don't need. So a woman is said to have irregular cycles if she has cycle lengths that have a difference of up to 7 days or more. That is the number of days from the beginning of one period to the day before the beginning of the next period. So for example, she has 27 days this month before she sees her period, and the next period comes 35 days after. That's 27, 35. If you have cycle lengths that are less than 21 days or more than 35 days, you have irregular cycles. If you miss your period for months and you're not pregnant, if you spot in between your cycle or just before your period for more than 2 days, right? If you bleed heavily, you can deduce this from the number of menstrual cycle products you use in a day. If you bleed for more than 7 days, also if you experience severe pain during your period, I mean the kind of pain that prevents you from going around doing your normal day-to-day activities. This pain can be accompanied with vomiting, nausea, right? If you experience any of these, then yes, your periods are irregular. The next step will be to visit the clinic. So first, your history will be taken to understand your cycles better. So you'll be asked questions like dates of your last periods. Have you ever used birth control? How long have you experienced this irregularity? Your lifestyle as well. Do you smoke? What kind of diet are you on? Are you under any form of stress? Are you eating well? Did you just start any rigorous exercise routine? These are all factors that can cause cycle irregularities. You can learn more from this ebook I put together called Period Reset. It's a guide showing a 4-step process for getting irregular periods back on track. Now, from your answers to the questions asked, tests will then be recommended. If you're spotting or bleeding irregularly in between your cycle, many times a pelvic exam and an ultrasound to check your reproductive organs will be recommended. Your vagina, uterus, cervix will be checked to see if there are any abnormalities that may have caused this, like things like fibroids, polyps. Do you have an infection? Your cervix will be screened for abnormalities as well from the HPV infection using a pap smear. If you complain of severe pain, the lining of your uterus will also be checked and measured, to see if there are any irregularities that may be causing this pain you feel. Now, for skipped period, missed period, late periods, your hormones will be checked following these scans using blood, of course. First, a pregnancy test will be done to rule out pregnancy, just to be on the safe side. Then your hormones, follicle stimulating hormone, that is the FSH, luteinizing hormone, the LH, these have to do with the maturation and release of the egg, estrogen, thyroid hormones, prolactin hormone on day 2 of your period. And progesterone will be checked much later in your cycle. These tests will give a better picture as to the reason why you may be having irregular cycles. So an example could be ovulation disorders. So maybe you're not sure if you ovulate, right? My previous video, which I'll link in the description or somewhere around here, talked about signs that indicate that a woman is not ovulating. So you can always go back and watch that video after watching this video, of course. If you're in your late 30s or early 40s and experience missed periods, late periods, or skipped periods, you would also have ovarian reserve test done, that is checking the anti-Mullerian hormone, AMH, because as we age as women, the quality of the eggs we produce reduces too. So this particular test will estimate the quantity of eggs left. So very low levels can cause skipped or missed periods, as you will be ovulating less frequently. That is if it is low, right? Now, if there are physical signs like excessive hair growth on the face, chest, or body, loss of hair on your head, in addition to some of the blood tests mentioned earlier and scans, your insulin levels will be checked and levels of your androgen hormones. So another name for these hormones is called the male hormones. So like the testosterone, the DHEA will be checked to give a diagnosis for polycystic ovarian syndrome, PCOS, if this is the case. Right? So if you have any questions on PCOS and would like to see videos in the future about it, drop a comment below, ask a question. Let's see what you want to know about that, and I just may shoot one video for you. So once the results are out, definitely a treatment plan will be discussed. Right? It could be long-term or short-term depending on your goals. For example, are you trying to conceive now or not? Or you just want to get your cycles right back on track, which is very important, because many times women would run to the clinic only when they are ready to conceive, which shouldn't be the case. So, do you want to talk more about your irregular periods? You can use the link in the description to book a free 20-minute discovery call to get to understand your cycle and next steps you need to take. Don't forget to get the period reset guide showing you a 4-step process on how to get your irregular periods back on track. Check for the link in the description to learn more. See you in the next video, where I'll be talking about reasons why a woman may not be ovulating. Right? Because sometimes think, okay, I'm not ovulating. Why am I not ovulating? Make sure you subscribe so you don't miss out. Cheers.